Hey, Atlas. Hey, Doc, what's up?
Hi, Miranda. What's going on?
Insurance.
Yes, we love insurance.
Claims and EOBs.
Yes. Let's talk. Come on in here.
What's the topic today, Doc?
Why don't we talk about chiropractic techniques?
Techniques.
Yeah.
Techniques are good.
So, when someone gets adjusted, the chiropractic technique is the manner in which we adjust them, okay? And there's a lot of different variations of different types of techniques we can use. So, the most traditional kind of chiropractic technique is the one that people are probably most familiar with. We call that diversified. And what that means is I'm using my hands and I'm manipulating them in a way where we move the bones. And that's most often where someone's going to feel or hear like that pop, you know, like they feel a snap in their bones, in their neck or the back. It's a release of pressure that builds up when someone's had an injury or some sort of stress on the joints. Usually feels really good, and some patients respond wonderfully to that. But there's a lot of other techniques that we can use. Some patients do not want that sort of adjustment, and maybe they've had injuries that don't allow them to have that adjustment. Maybe it just kind of makes them anxious to have someone maneuver them in that way. They still need chiropractic care. They still have issues that are related to chiropractic. Maybe their back hurts, their neck hurts, they've got sciatica, headaches, migraines, they're fatigued or sick, something like that. But they don't want that kind of adjustment, or maybe they just can't tolerate it at that point. So thankfully, there's a lot of ways that we can adjust the back or the neck or any bone in the body without having to be super aggressive. So patients like that, I might use the table. So this table can rise up and then it drops away, and I can use that toggle of the table to adjust like the pelvic bone or the lower back bone. We can use the movement of the table here to stretch. So if someone has a lot of back pain, I can stabilize some areas in their back, and the traction alone, as I stabilize the bones in the back, will take a lot of pressure off the nerves that leave the back, and maybe their back pain gets better, their sciatica gets better, but it's not aggressive, and it's very, very safe.
That's one of my favorites.
So the traction is a really good way as well. So we can use the table, and the table has a lot of different ways that allow me to adjust someone in a way that's safe for them and good for them. And then lastly, we also have some instruments that chiropractors can use. This is called an impulse. There's other instruments called activator. They're all relatively the same in terms of how they work. But essentially, I might find an area on the back or neck that needs an adjustment. I make some contact with this, and we use this impulse to adjust. This is very safe, very, very effective. Some patients really, really love this. And I have patients who come in and this is the only technique we'll use. I won't use any manual techniques at all. I have other patients that I might start with this and then we graduate to other areas depending on what they can tolerate. The biggest thing with techniques is people think, how am I going to get adjusted? And I understand why they would. First, we figure out why they're going to get adjusted. We figure out what's going on with them, what we can do to help, and then we figure out the how as we go along. And techniques might change over time. If someone has injuries or other issues that come about, I might no longer use the hands technique, I might use more of the table. As people get more confident in getting adjusted, we might graduate to more of the diversified or the hands. The most important thing I tell patients is talk to me, tell me how you're doing, tell me what you need that day, and we'll find the right technique to get them feeling better. That's really what it's all about.
Sounds great.
Thanks, Miranda.
Yeah, have a great day.